The former Prime Minister leaving the Covid-19 inquiry after 105 minutes giving evidence to just a little bit of heckling. David Cameron was the first politician to take the stand in this first module looking at resilience and preparedness.
I swear by Almighty God that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
The central question, whether government cuts to public services on his watch impacted the handling of Covid-19.
Making these difficult choices about spending it wasn't a sort of option that was picked out of thin air. I believed, and I still believe, it was absolutely essential to get the British economy and British public finances back to health.
No matter how many times the former Prime Minister was asked about austerity measures, he insisted that the country needed them in order to be able to face any crisis that might come their way. He was also insistent that they had prepared for a pandemic. It was just the wrong one.
The age of irresponsibility is giving way to an age of austerity.
It is what won him the 2010 election, so there was never any doubt he wouldn't defend his government's economic measures. The problem with the pandemic response, he said, lay elsewhere.
Much more time was spent on pandemic flu and the dangers of pandemic flu rather than on potential pandemics of other more respiratory diseases like COVID turned out to be. And, yes, you know, I think this is so important because so many consequences follow from that.
The convoy bringing an Ebola patient to a London hospital, and Mr Cameron was reminded that he had described it as a wake-up call to the emergence of a more aggressive and more difficult to contain virus. He said they had also looked at the outbreaks of MERS and SARS.
When you think what would be different if more time had been spent on a high infectious asymptomatic pandemic, different recommendations would have been made about what was necessary to prepare for.
PPE shortages dominated the headlines in early 2020, and in his written statement to the inquiry, the former Health Secretary, Jeremy Hunt, said Hong Kong hospitals were required to have 3 months' supply. Nothing to do with austerity, Mr Cameron said today.
Money was tight and we made difficult decisions about public spending. When we did need to spend money on important priorities, when we had to spend money on Ebola, we did and we would.
The Trades Union Congress today described the former Prime Minister as being in denial.
NHS waiting lists were twice as long as we entered into the pandemic as when he first took office. It's why, when you factor in our ageing population and population growth, NHS levels and spending on healthcare was, for the first time in decades, less than real terms between 2010 and 2016. He just seems to be unable to face the facts and the realities that his policies had a huge detrimental impact on our country, and in particular our healthcare and social care systems.
Mr Hunt will give evidence on Wednesday when he will face questions about a claim today that he had failed to attend high-level meetings on major infectious diseases. And tomorrow, the former Chancellor, George Osborne, will take the stand.
Well, earlier I spoke to Sir Michael Marmot, a leading expert on health inequality, who had earlier told the inquiry that austerity had made the pandemic worse. I began by asking him what he made of David Cameron disagreeing with his evidence.
Well, firstly, he didn't really engage with the key part of my testimony and my reports. Pre-pandemic, life expectancy had more or less stopped improving after 2010. After 2010, health inequalities had got bigger, and after 2010, life expectancy for the poorest people got worse. So that's where we were pre-pandemic, and he didn't really engage with that. Now, what he did engage with is he said that couldn't possibly be due to austerity. Well, that's flying in the face of scientific opinion. What happened post-2010? They had austerity. We saw that health care funding, the NHS funding, when you adjust for the size of the population and the aging of the population, under New Labour, it had been going up 5.7% each year. Under the Cameron government, it went down. It went down. It was minus 0.07%, and under the next government, minus 0.03%. Social care funding went down by about 3% per person in the least deprived 20% of areas, and by 17% per person in the most deprived 20%. And that was part of the reduction in spending by local government. So to look at that and say nothing we did could have possibly made any difference, seems to me is just flying in the face of the evidence.
Forgive me for guessing how you feel, but you sound sort of irritated with what you heard. I mean, is this part of sort of post-truth politics in your view?
I want us to look at the evidence. I spent all my time looking at the evidence, and to have a former prime minister say, no, we left the country in good shape. But that flies in the face of the evidence. He said, the prime minister, the former prime minister, Mr. Cameron, said, we left the economy in good shape, which is why we were in such good shape to deal with the pandemic. Well, I look at the figures. Real incomes per person are 5% lower now than they were 18 years ago. They declined under his watch. So he didn't leave the country in economically in good shape to deal with the pandemic. We're in terrible shape. So yeah, I'm irritated because I spend all my time looking at the evidence, and to have somebody come along and say, I don't care what the evidence shows, just listen to what I say.
His fundamental argument is that it was our job as the government to set the economy back on a stable footing, and that's the only way to ensure that the NHS has any funding at all. Does that have merit?
It's a very meritorious argument. It's just that they didn't put the country back on a good footing. We had severe austerity in this country. There was a lot of debate at the time between the Keynesians and those pushing austerity. Keynesians said the time to spend is right now. And the people pushing austerity said, no, we've got to stop spending now. The government chose one side of that debate, and they got it wrong because the economy didn't grow. And they can say we left the economy in good shape, but that's not what the data show.
Sir Michael Marmot, thank you very much.
Thank you.